So hey everybody, and welcome back to another week and another episode of Health and Relationship with YayraRose. This is the channel where we talk about anything raw, anything that you wouldn't want to talk anywhere else or talk to anybody about sometimes. But you want to know, you know what I mean? So we talk about the benefits of quite a lot of things. We talk about relationships and issues and how to deal with certain things, and yes, we talk about sex as well. And today's video is kind of a bit raw, so I'm gonna warn you guys, too much information in case you're not that type to be getting too much info and getting gory details about certain things. There's no need to be shy on this channel, guys. This is everyday life. It's on your body. You go through it. These are things that we experience as we go along, and sometimes we feel so lost because we just don't have that information to kind of like help us. So I'm just here to share my experiences, my research, the small amount that I know. And I hope that you guys pass information on to me. You may know more than I do, obviously. So yeah, we're just gonna be having a quick conversation, and today we are going to be talking about inside the vagina. Yeah, we are going to be talking about the vagina today, guys. There are some people who may not know what a vagina is. Honest truth, there are some people who don't know what a vagina is or what it looks like, what the anatomy of it, the things that it's supposed to do. And I think that the more you know about it, you get to familiarize yourself with it. It's easier for you to, kind of do understand certain things about it. So today, guys, we're going to be talking about the vagina, inside the vagina, and pretty much, it's on you, it's live. We have to know these things so we don't get lost. Knowledge is power, guys. Knowledge is power. Anyway, let's head straight into the video. Okay, so as I talk, guys, I'm going to be putting pictures just so that you can, walk this topic with me and understand where I'm coming from. So we're talking about the vagina. The vagina is obviously the female organ. The vagina, the way I'll describe it, is I would say a flexible tube that joins the uterus to the vulva. Okay, now vaginas vary, obviously, among individuals in the color, in the size, and also in the shape as well. Not all vaginas are the same. They look different. The colors are different. You can get a dark one, a pink one, you can get a different kind of shape. You can get a thick, a small, a large, a heart shape, or a cylindrical kind of shape, oval shape. Varies among individuals. Okay, now getting to know what the inside of a vagina looks like and what is normal for each individual can help people feel more familiar with their body. And it can also help with identifying abnormal changes. It's not just about having sex or whatever else you want to know your vagina for. It also helps you to identify if something is wrong down there, just so that you can, seek medical help, So now we're going to have a look at the anatomy of the vagina and how to do a self-examine. We also discuss the symptoms that can indicate a health issue with the vagina. So guys, I'm going to be showing you this. So this is what the vagina looks like, guys. I'm going to be obviously inserting a picture at the top there just so that you can see it properly. This is the outer lips, obviously the outside of it, the skin around it, and then you've got the inner lips as well, which is this part of it. And then you've got the other side, the urethra, that dot over there where you wee from. And then you've got the clit as well. So I'm going to be explaining all this to you guys just so that you understand. We also have the vagina and the uterus. So we have the fallopian tube, guys, and then the ovary, obviously, where you get pregnant and stuff, and then you've got the uterus, you've got the cervix as well, which dilates for the baby to come out, and then you've got the actual vagina, which is this one right here. So there's quite, and the hymen as well is a very important, very important topic. It's a very important name that's going to come up during our discussion as well. So please take note. So the vagina is an elastic tube, like I said, that connects the uterus and the cervix to the vulva. Now the vagina is about 3 inches long. The shape of the vagina can vary from person to person, like I said. Some vaginas are oval, kind of like an egg, and then you have others that are more like a cylinder kind of type shaped. The opening of the vagina is between the urethra, through which the urine leaves the body, and then the anus as well. The vaginal opening is where the blood leaves the body during menstruation. A penis enters during sexual intercourse, and a baby leaves the body during birth. So that hole is what the vagina is. The hymen, guys, this is very important. The hymen is a thin layer of tissue that surrounds and partially covers the vagina opening. So sexual intercourse or exercise can stretch or tear it. So if you're a virgin, for example, the first time you have sex, you are actually, tearing that up. You're actually tearing that up. So that's why the first time you have sex, you have to be very careful. You have to go slow, because if you rupture the hymen, you're going to be having all kinds of other issues as well. So always be mindful of that covering around the vagina opening as well. The cervix connects the uterus to the vagina, guys. A small hole in the cervix allows the menstrual blood and sperm to pass through. During childbirth, the cervix dilates, like I said earlier, for the baby to come out. It gives that opening for the baby to come out. You also have the vagina that expands through arousal and also sexual stimulation as well. So during sexual arousal, the uterus and the cervix lifts upward. So people refer to this process as tenting. The glands are on either side of the vagina opening as well. People cannot usually see or feel these glands. During arousal, guys, the glands release fluid that lubricates the vagina, and I think some of us have experienced that kind of lubrication as well. The Grafenberg spot, which is known as the G spot, sits a few inches inside the vagina, okay, at the front. So during arousal, the G spot will swell. Okay, it will swell. The area visible externally, which is the vulva, is what many people refer to as the vagina. So, however, the only part of the vagina visible outside of the body is the vagina opening. Okay, I think we get this kind of confused a lot. So we are now on how to self-exam, guys. So a person can carry out a self-examination of their vagina to check off any unusual changes that may indicate a health issue. So self-examinations are useful alongside regular gynecologists, pelvic examinations as well. And also the cervical screening as well that you're supposed to do every 2-3 years. These are all very imperative just to check nothing abnormal is going on down, in your vagina and in your cells as well. So people can carry out self-exam of vagina when they are not menstruating. Okay, for the self-examination, you will need like a mirror, a handheld mirror, also like a light or a touch, and pillows for comfort as well. So people can carry out this by, obviously wash your hands with soap and water, and also remove the clothes, lean against the wall, pillows to support the body, bend your knees, hold the mirror and the light in front of the vagina, use one hand to spread the opening of the vagina, and then place your finger inside the vagina gently, and feel the walls of the vagina, which feel similar to the roof of the mouth. So what you're feeling for is like lumps, bumps, or raised areas that could be sore or unusual growth. This is quite imperative, guys. So to feel for the cervix, it may help to move to a squatting position. Okay, so you just basically just gently insert your finger deeper into the vagina to feel the cervix. So vaginal discharge, guys, can change slightly in consistency and color during the menstrual cycle, pregnancy, and menopause. Healthy discharge is usually clear to white or a pale yellow, and you can have a mild, smell as well. If a person notices anything significant change in their vaginal discharge, this could indicate an underlying issue. The individual can obviously see a doctor, have a checkup, and then report your symptoms. It's better to get it. I know it can be a bit intimidating, speaking to somebody about something so personal like that, but it's better for you to deal with that ASAP rather than wait and linger and just thinking that it's going to clear up. Get medical check, guys. So signs of a problem, guys. A range of conditions can affect the vagina and how it looks and feels inside. So signs and symptoms of conditions affecting the vagina, guys, may include unusual discharge, like I said, pain, and visible changes as well. So here we're going to be talking about those certain things that happen to the vagina or in the vagina that you may not be aware of. Okay, we have the vaginitis, which is an inflammation or irritation of the vulva or vagina. There are many causes for this, including sexual activity, reduced estrogen levels. It can be red and itchy, sore. It can have that burning sensation as well, like pain during sex. It can be frequent and stinging urination as well. And then we come to vaginismus. Vaginismus. That's a sudden tightening of the muscle surrounding the vagina that occurs when a person tries to insert something into it. Okay, so the vaginismus is an automatic response of the body over which the person has no control. Okay, so the symptoms could be trouble inserting something or like a tampon into the vagina, or difficulty with vaginal penetration, and also a burning sensation or a stinging pain during sex. Now you've got sexually transmitted infections as well, which is the STI, normally known as STI. That can cause symptoms and around the vagina. So many of these STIs may appear without noticeable symptoms or any. They may seem kind of similar to like vaginal infections, to be fair. So if you have any of these things, guys, seek medical attention. Okay, and then you have the genital warts as well, guys. These are a small collection of flesh colored bumps around the genitals or inside the vagina as well, which may have a cauliflower texture, that kind of grainy texture to it. And then you have trichomoniasis. If you have it, it may be foamy down there, kind of like a yellow-green discharge. kind of like a foul smelling discharge as well, spots of blood in the discharge as well. This is serious. Discomfort when urinating, you have itchiness, redness, burning around the genitals as well, guys. Any of the symptoms, guys, seek medical help. Seek help. You've got gonorrhea as well, which shares symptoms with the vaginal infections. So pretty much the same burning sensation, increase in vaginal discharge, bleeding between periods, painful bowel movements, itchiness and soreness as well. Chlamydia is also another one. More or less, all of them have the same symptoms. Vaginal infections, you have thrush as well. The symptoms, guys, could be a gray, green, or yellow discharge on most of these infections, a burning or stinging sensation, like I said, pain during sex, bleeding during sex as well, swelling, pain, redness of the vagina, itching sensation of the vagina. You've got the vaginal cancer as well, which includes feeling a lump in the vagina, painful sex, pain when urinating. Guys, the list goes on. The list actually goes on. You do have UTI as well, urinary tract infection, and that one has also, gives you that burning sensation. There's a bunch of stuff. So guys, take care of your vagina. Take care of your vagina, because out of that floweth, beautiful things, on a serious note, guys, I hope that information helps you. If you do, my concern is that if you do get anything in relation to the symptoms, guys, don't sit on it. Get it looked into quickly. There are obviously home remedies that you can do. If you want me to, give you info on that, please let me know in the description box below, and I should do that for you. But in the meantime, guys, have a look at this video, ponder on it, do your own research, and as usual, stay blessed, and I'm going to see you in the next video next time, guys. Take care. Bye.